Eating disorders are a serious problem that affect people both in and out of the spotlight. Demi Lovato opens up about her own firsthand experience with eating disorders.
When I started to have body image issues, I remember being 3 years old in a diaper and rubbing my hand over my stomach and just feeling like, I remember thinking in my head, I wonder if one day this will ever be flat. And it just continued. I always had self-confidence issues in my body and self-image problems. And, you know, it started when I was around 8 years old that I really started what we call it is binging, binge eating. I think that any eating disorder, some people, I believe, people have their different opinions on it, but I believe that I was born with it and that it was just gonna be there. You know, it runs in my, my family.
When I was growing up, I had no one to look up to in the spotlight that was a regular-sized girl. Like, this was the time when socialites were very, very thin, that I couldn't do it on my own. The difference is now is when I don't want to eat or I want to throw up after a meal, I tell somebody, and that instantly takes away the power of what that has on me.
Anorexia nervosa is an eating disorder in which a person maintains a starvation diet besides being significantly underweight. The causes of anorexia involve psychological and societal influences. The disorder typically begins as a weight loss diet, and also the families of anorexia patients tend to be competitive, high-achieving, and protective. When girls feel like they are helpless and can't control themselves, they instead turn to starving themselves because their hunger becomes something that they can control. People with anorexia tend to feel fat, fear gaining weight, obsess over losing weight, and sometimes exercise excessively. A common misconception about anorexia is that it is not serious and simply a lifestyle choice. However, when left untreated, people suffering from it may die. Another misconception is that anorexia only affects adolescent females, when in reality, it can affect anyone.
Bulimia nervosa is an eating disorder in which a person causes themselves to vomit or causes themselves to lose weight by fasting. It is a serious mental issue that needs to be handled immediately. It usually is seen mostly in teens and women in their early 20s. Along with it, it's usually caused by people who binge eat as well, usually being persuaded by their peers. Misconceptions about bulimia also include that you can tell someone has bulimia simply by looking at them. This is false, and often people of all shapes and sizes can have this disease as well. Other misconceptions include eating disorders are caused by photoshopped images or media, while in fact it's usually biological or genetic factors that play a factor in people having this disease. Another misconception is that men don't tend to get this eating disorder, where in truth, 1 out of 10 people are men. 1 out of 10 people suffering from this are men.
The last of the major eating disorders is binge eating. Binge eating is the excessive consumption of food with remorse, but without purging, fasting, or excessive exercise. Like alcoholism, which compels people to drink, binge eating compels people to eat. Binge eating also activates specific parts of the brain, similar to how cocaine and heroin do as well. Genetics also plays a major factor in eating disorders, as identical twins are more likely to develop the same disorder than fraternal twins. In a recent interview with People magazine, Ashley Rickards, the star in the show Awkward, recently opened up about her own eating disorders. Starting at the age of 7, it only got worse when her neighbor commented, "We don't need to get Krispy Kremes, you've got a jelly roll right there." This is an example of how eating disorders should never be taken lightly, as a joke, and by anyone. Ashley eventually found help through talking with her friends and even with a therapist. So how else can we find help?
Various types of therapies are within a big branch of psychotherapy. Treatment involving psychological techniques consists of interactions between a trained therapist and someone seeking to overcome psychological difficulties or achieve personal growth. One modern psychotherapy is group and family therapy. It heals relationships by developing an understanding of family and other social systems, exploring roles, and improving communication. Another is cognitive behavioral therapy. It promotes healthier thinking and adaptive behaviors by training people to counter self-harmful thoughts and behavior. And last but not least is the client-centered therapy. It enables growth via unconditional positive regard, genuineness, and empathy by listening actively and reflecting. Many people also participate in self-help and support groups. Those struggling with anorexia often join groups, seek nutritional counseling, or take medication.
Today's eating disorders are mainly caused by our weight-obsessed culture. Women are taught to believe that fat is bad and dieting is necessary. Girls who are already dissatisfied, idealizing thinness, and lacking social support are the ones who are at highest risk for developing an eating disorder. In order to decrease the occurrences of eating disorders in our society, we must encourage people to accept their bodies and change the unrealistic social conceptions of a perfect body.
Eating disorders are a serious issue that should be taken very seriously. In order for us to overcome this disease, we have to be willing to accept people for who they are instead of what they aren't.
Speak out, seek help. Don't change yourself to fit societal standards. You have a community to support you always.